Welcome to another episode of the Exhale Podcast, a candid conversation about current matters relating to respiratory, diagnostic, and lung health. Today's host is Mark Russell, Marketing and Communications Manager for Vitalograph in North America, a global leader in respiratory diagnostics. Vitalograph is a proud partner with NIOX to improve accuracy in asthma diagnosis and monitoring. NIOX has been at the forefront of FeNO testing for 25 years. And this year, Vitalograph is marking 60 years in respiratory diagnostics expertise. During these 60 years, Vitalograph has become synonymous with spirometry, and as an organization, it is continuously looking at how it can enable better patient outcomes with accurate, reliable data through a range of diagnostic solutions. Today's conversation is with Karen Frankland, lead nurse for education and support at NIOX Group. We are exploring spirometry and FeNO testing, specifically how these tests provide physicians with a variety of data to inform asthma care pathways for patients.
Well, Karen, welcome to our podcast.
Thank you very much indeed.
Please give us a little background on yourself, education, experience, and current responsibilities.
Yes, so I'm a primary care respiratory specialist nurse and also a qualified teacher. I've got over 30 years experience in the N.H.S, in occupational health and also the pharmaceutical industry. My career in the N.H.S began in Manchester as a general registered nurse before specialising in respiratory medicine. My previous roles have included senior clinical nurse advisor, where I was responsible for delivering specialist clinical nursing services and also for the training and development of regional and national nurse teams. After that, I worked for 6 years as head of short course provision for an organisation called Respiratory Education UK. They're a national training provider based in the Northwest. And then I was team leader and training lead for the pivotal Salford lung study. My current role with NIOX Healthcare is as their lead nurse for education and clinical support. And this includes delivery of asthma and FeNO masterclass education sessions, and also support to a range of clinicians and healthcare professionals for the inclusion of FeNO testing in their asthma services.
Can you give our listeners an overview on how you have seen asthma diagnosis and management evolve in your career?
Yes, so as I've mentioned, I've been involved in the care of patients with asthma for many years. And during that time, there have, of course, been significant changes. So in the way that asthma is defined and diagnosed and managed. So firstly, it's increasingly accepted that asthma is an umbrella term. And there's several clinical presentations and also distinctly different inflammatory patterns that sit underneath that umbrella. There's now a lot of emphasis on heterogeneity of asthma. And this term relates to the differences and variables that we see amongst our asthma patients. So, for example, this could be the age at which somebody is diagnosed. It could be a child or it could be an adult. We see differences in symptom presentation or triggers or levels of severity. And this has all led to changes in asthma definitions in the clinical guidelines in a way in which to help clinicians with their diagnosis of asthma in clinical practice. And then in terms of asthma diagnosis, the changes I've seen are that a clinical assessment and the suspicion of asthma should now be supported by objective evidence. So looking for variable airflow obstruction and inflammation. As yet, of course, there's no single gold standard test. And a big change was also the introduction of spirometry testing in primary care. And we've now got much more sophisticated tests such as FeNO, which is becoming increasingly available. The management of asthma has evolved in terms certainly of the way that we approach it. So historically, patients were prescribed a short-acting bronchodilator initially, and this changed with the emphasis on inhaled corticosteroids as the first-line treatment. Further changes have shown that patients have different responses to treatment, and there have also been the development of biologics for those patients with severe asthma. And then in addition to that, we've had the evolution of home monitoring and digital apps, which give patients the tools to manage their asthma much more effectively. And I feel that what's most important is the need to continue to improve the current diagnostic and management practices so that we can reduce avoidable morbidity and mortality that are currently associated with asthma.
Can FeNO be used as a standalone test, or can it be used alongside other tests such as spirometry and bronchodilator reversibility?
Well, first of all, I'd like to emphasise the importance of a good, detailed clinical history and patient assessment, which must be performed initially. This is absolutely vital for accurate diagnosis, and following this, various objective tests should be performed to confirm those clinical findings. So spirometry and reversibility tests will help to identify the presence of airway obstruction and also response to a bronchodilator. And then FeNO measures the presence and the level of type 2 airway inflammation. Therefore, no objective test should be reviewed in isolation. And FeNO is an important piece of the asthma puzzle when you use it alongside the other objective tests and clinical assessment.
What impact does FeNO testing have in improving the diagnosis and treatment of asthma, impacting patients' quality of life?
FeNO testing, or fractional exhaled nitric oxide, is a quick, simple and non-invasive objective test, and it helps with both the diagnosis but also the ongoing management of asthma. It's used to assess inflammation by measuring a gas called nitric oxide, which is present in the airways. And we know that those patients that have type 2 asthma inflammation have an increase in their gas nitric oxide because it's released by inflammatory cells in their airways. We know that misdiagnosis of asthma is very common, and FeNO can really help to improve diagnostic accuracy by identifying type 2 inflammation early. And also doing repeated FeNO measurements enables clinicians to really assess the variable nature of asthma inflammation. So again, alongside the clinical assessment, FeNO helps with clinical decision making and optimizing inhaled steroid doses. So this might mean increasing doses or stepping down when the patient demonstrates good asthma control alongside a low FeNO level. And another key area is helping to uncover poor adherence with inhalers, which we know is very common in asthma, and being able to explain the FeNO value plays a huge role in patient education, including the importance of taking regular inhalers, which will make a difference in improving day-to-day quality of life.
What makes FeNO testing a convenient and simple test for asthma patients?
Well, firstly, FeNO is an easy test to perform at the point of care. So it's suitable for all ages, so from patients from the age of 4 years, and also for patients who've got severely reduced lung function. In addition to that, there's no complicated preparation for the FeNO test, and there are inbuilt audio and visual animations that provide direction for patients to complete the test accurately and to exhale at the recommended flow rate. The gold standard exhalation time is 10 seconds, and there's also a 6-second pediatric setting for children under the age of 10. Test results are available immediately, and therefore any ongoing actions and management plans can be discussed and decided upon with each patient straight away. And then finally, FeNO is increasingly available in both primary and secondary care settings, so it's accessible for all patients.
What kind of preparations do patients require before undergoing FeNO testing to ensure accurate results? Are there any specific guidelines for carrying out this test?
Yes, there are. So there are things from a practical consideration. So there are some factors that can actually influence the production of nitric oxide in the airways, and these should always be taken into consideration in the interpretation of the result. And they also relate to the very important pre-test information that we give to patients before they come in for a FeNO test. So some of the things to consider are the presence of allergic rhinitis, which is very common in asthma patients, and this can cause an increase in nitric oxide levels. And also considering things like if you've eaten a meal that contains a lot of nitrate-rich foods, and these would be green leafy vegetables, also drinking caffeine or alcohol. And then other things to consider are smoking and vaping, and vigorous exercise can also affect FeNO results. So patients should be asked to avoid certain things for at least 2 hours before the test. And there are, as I say, patient information leaflets that are available for this.
What should physicians look for when interpreting FeNO test results?
The first thing I would say is that national and international guidelines do vary slightly in their recommendations. So it's really important to be consistent and that everybody is working to the same guideline. The things to look for, first of all, if you have an asymptomatic asthma patient, the good news is that if they have a low FeNO level, this is likely to imply adequate dose of inhaled steroid. In addition to that, good adherence, good inhaler technique, and confidence that there's no inflammation in the airways. And in this instance, a gradual reduction of the steroid dose could be considered, as long as there's regular monitoring of the symptoms and the FeNO during this time to give the clinician confidence that asthma control isn't being compromised as the steroid dose is being reduced. Alternatively, a low FeNO level could imply the absence of type 2 airway inflammation, and in this case, the patient would be unlikely to benefit from treatment with inhaled corticosteroid therapy. However, it's important to point out that this doesn't rule out a diagnosis of asthma. So in these cases, it's important to consider alternative diagnoses and the reasons for the presenting symptoms. The American Thoracic Society standard is that a level less than 25 parts per billion would be classed as low or normal FeNO. And in children, it's slightly lower. So children under the age of 12, a level less than 20 parts per billion would be classed as low or normal. So a high FeNO value, so over 40 or over 50 parts per billion in adults and over 35 parts per billion in children, indicates that airway inflammation is likely. This would support the clinical diagnosis of asthma and also indicates that the patient's likely to respond to treatment with corticosteroid therapy. A high FeNO value could also suggest exposure to allergens or non-adherence with corticosteroid therapy. And as I've mentioned before, this is something that's very common amongst our asthma patients. It could also indicate poor inhaler technique in those patients who are receiving treatment with inhaled corticosteroid. So those would be really the things to look for when interpreting results.
And Karen, where can they find out more about FeNO testing?
You can find the recommended cutoff points and lots of other information about FeNO testing online or via Healthcare and Respiratory Society website and also at NIOX.com. And of course, people can feel free to message me as well. So that would be info@NIOX.com. So that's NIOX. And I'd be more than happy to help with any queries.
Karen, I appreciate all this great information, and we appreciate you being on our podcast.
No problem at all. Thank you for asking me.
You've reached the end of another episode of the Exhale podcast. Don't forget to follow us for upcoming new episodes, and please take our survey to help us provide good content for the future. To find out more about FeNO, make sure to visit NIOX.com, where you will find a wealth of educational materials, including articles and videos. For any questions for Linda Frankland, email her at info@NIOX.com. Thank you for listening, and we look forward to you joining us again on the Exhale podcast, brought to you by Vitalograph.